In the quiet of night, thousands of individuals with obstructive sleep apnea turn to Philips CPAP machines, trusting these devices to provide a steady flow of air to maintain breathing patterns. Initially hailed as a revolutionary solution, the narrative took a dramatic turn in 2021 when Philips issued a recall for several of its models. Users were potentially inhaling toxic particles from the degradation of the foam used in the machines. This issue not only highlighted a severe oversight in product safety, but also underscored the vulnerability of patients relying on medical devices for critical care. Expert analyses revealed that the polyester-based polyurethane PPR foam, designed for sound abatement, was breaking down, possibly due to exposure to certain cleaning solvents or environmental conditions, releasing particles and gases that could be toxic or carcinogenic. This revelation prompted urgent reviews by regulatory bodies worldwide and spurred a slew of lawsuits from affected users, paving the way for the multi-billion-dollar settlement announced this year. As news spread, trust in Philips and similar devices plummeted. Regulatory agencies, already under scrutiny for their oversight mechanisms, faced increased pressure to tighten their review and approval processes. This incident has become a textbook example of what many experts call regulatory lag, the gap between emerging medical technologies and the guidelines that govern them. The $1.1 billion settlement agreed by Philips not only addresses financial compensation for the users impacted by the faulty devices, but also sets a precedent for the responsibility of medical device manufacturers. Legal experts point out that such settlements, while rectifying the immediate grievances, evoke a broader question about the efficiency of pre-market testing and post-market surveillance in the medical device sector. This wide-scale compensation also casts a stark light on the societal implications of medical device failures. Such incidents dent the collective public trust, not only in the products, but also in the systems that allow their dissemination without adequate safeguards. Health policy analysts argue that while companies must innovate, they must also invest comparably in safety testing to assure the users of new technologies. In interviews, several legal and healthcare policy experts have suggested that the repercussions of such settlements extend beyond immediate financial losses. They urge a systemic overhaul, pushing for robust testing frameworks, more transparent reporting mechanisms, and stricter penalties for non-compliance, which could help in preempting such crises. Looking forward, the Philips CPAP controversy serves as a stern wake-up call for the entire industry. Manufacturers are now tasked with not only enhancing their design and testing protocols, but also maintaining transparent communication channels with both regulators and the public. This incident has underscored the necessity for ongoing monitoring and rapid response strategies to identify and address potential risks swiftly. For healthcare providers, the controversy has highlighted the critical role of vigilance in post-market device surveillance. It denotes a shift towards proactive patient education about the potential risks associated with medical devices and the importance of reporting any unusual symptoms. In conclusion, while the Philips CPAP settlement begins to close a troubled chapter, it opens several new avenues in the discourse on medical device safety. This case study not only reflects on past mistakes, but also charts a course for future innovations to be rolled out with heightened scrutiny and responsibility, potentially setting new benchmarks in healthcare governance and corporate ethics. To keep up on news that you won't hear on the mainstream media, subscribe to the Ex-Pharmacist's channel and turn on notifications for honest and clear news about often complicated topics.